proceeding, we'd like to take an acknowledgement of our joint partnership with DC Health. The Institute for Public Health Innovation is pleased to offer grants to primary care providers in DC in this pilot to bring cutting-edge healthcare technology to their practice. The purpose of this funding aims to test and evaluate technology solutions to decrease electronic medical record documentation time, which is a key driver to primary provider burnout. The U.S. Surgeon General's advisory highlights the need for immediate attention to health worker burnout, emphasizing system-oriented solutions such as speech recognition software to reduce administrative burden and EMR turnaround times. EMR burden is a significant stressor for a clinician, and speech recognition software has been found to reduce administrative burden and time spent on EMR. A 2018 systematic review found that implementing speech recognition technology has reduced turnaround times by over 90%. In November of 2022 to around January 2023, DC Health conducted a study focusing on workforce wellness. DC Health engaged with multiple stakeholders at federally qualified health centers, also known as FQHCs, community health centers, hospitals, and health systems to discuss key factors that impacted workforce wellness. Administrative burden, particularly related to EMR, was consistently cited as a source of stress and burnout. Providers had identified issues such as difficulty working in and navigating through EMR, the lack of ongoing training, and an increase of messages received electronically through their patient portals. Other key factors identified in this study included work outside of their paid hours due to the frequency of the work on EMR documentation and patient messaging outside of their paid work hours. As a solution, in joint partnership with DC Health, the Institute for Public Health Innovation in this pilot aims to reduce primary care provider burnout in DC due to the EMR burden by awarding funds to eligible applicants to purchase and implement EMR assistive technology solutions. This funding opportunity will not only help primary care providers fund the costs to purchase technology, but will also provide protected time for providers to train on and implement the technology and support staff to conduct data collection and reporting activities. Heading on to our partner backgrounds, we'll start with DC Health. DC Health's mission is to promote and protect the safety and quality of life of their residents, visitors, and businesses in DC. The agency is responsible for identifying health risk, educating the public, preventing and controlling diseases, injuries, and environmental hazards, as well as promoting community collaboration and optimizing equitable access to resources. In this pilot, DC Health will be serving as the funder of this opportunity. The Institute for Public Health Innovation, IPHI, is serving as DC Health's administrative agent. We will be promoting funding for this opportunity, review eligibility, distribute funds to the organizations, ensure funds are used for allowable activities, and collect data from sites before and after the implementation of technology solution. The District of Columbia Primary Care Association, DCPCA, will offer technical assistance to primary care providers to implement solutions for eClinical Works, an EMR that is widely utilized by primary care providers in DC. We'll go on to our first Q&A portion of this presentation. At this time, if you have any questions, please feel free to type it in the chat or the Q&A function, or raise your hand to ask verbally if you'd like. We'll give some time for chats to come in. It looks like we don't have any questions at the moment. We'll move on and we'll be sure to address any questions later on at the other sections at the end of our presentation. Our next portion of this presentation will start with our application overview. At this time, I would like to turn it over to my colleague, Lauren. Lauren is a senior program manager for the Institute for Public Health Innovation. She serves as the project director for this project and has many years of experience in grant administration. Take it away, Lauren.
Thank you so much, Sam. Sam is actually going to drop into the chat for everyone a link to the webpage for this pilot opportunity on IPHI's website. This webpage will also be available in our follow-up materials, and we'll actually go through the page together so you can see exactly what to expect when you go to seek out materials and apply for this great opportunity. So as mentioned, the materials you need to prepare for the application and a link to the application form are available on IPHI's website. That link has been put in the chat. On screen now, I'll navigate to that same page from IPHI's homepage so you all can see how to access this particular web page. This is our main screen here when you go to IPHI's homepage. Then if you click on focus areas, you'll see a list of the different ways that we work in our community. Here, we'll want to select outreach and health promotion. That will take us to this page where we have a tiled list of the different projects that fall under this particular category of outreach and health promotion. The tile for this grant opportunity is here, Improving Healthcare Workforce Wellness, a pilot to reduce EMR burden. And if you read more about that opportunity, it will take you to the page that Sam has linked to in the chat, which is the primary page for this funding opportunity. And this is where you'll be able to find all of the materials that we will go through together today. That will include the request for applications or application overview, an FAQ, which will be updated following this webinar to include any additional questions we receive today, a sample application form, and a budget template with instructions. Eligible applicants include single provider practices, multi-provider practices, federally qualified health centers, and health systems delivering outpatient primary care health services for underserved populations. You can see there in that blue pull-out box how you meet the definition of underserved per DC Health's guidelines for eligibility for this funding opportunity. 3 things to note for eligibility. First, the applicant organization must be located within Washington, D.C. You will be asked to provide an address during the application. The second thing of note is that designation for serving underserved communities. The applicant organization must meet the 45% minimum requirement for primary care encounter volume. During application, you will be asked to provide a total percentage of the community served that meets this criteria. If you are awarded funds, continued eligibility will be verified through reporting. And we'll discuss those reporting requirements in detail a little later in this presentation. The third thing to note is that anyone from the applicant organization can complete the application, as long as you have the authority within your organization to do such tasks. The person completing the application does not have to be a primary care provider participating in the pilot. It could be, but it could also be a physician's assistant, an office manager, a financial representative, anyone in the organization who can take on this task. One thing that we do recommend is that the intended applying individual reviews the sample application form that's provided on the webpage, just to make sure that that individual does have access to all of the information that will be necessary to complete the application. Next, we'll speak about the allowable use of grant funds. As you're crafting your budgets and thinking about how you will approach the implementation and training for this technology solution, be aware that you'll be able to utilize up to $2,500 per full-time primary care provider. That full-time designation is seen here on the screen. This is an individual within the organization who is delivering 32 hours or more of direct patient care. For each application, you can include up to 10 participating primary care providers. Again, each eligible for grant funds up to $2,500. Grant funds not only cover the upfront cost to purchase the EMR assistive technology solution and any related accessories like a microphone or a headset, but also offer protected time through grant funds for the participating primary care providers to train on and implement the technology solution, and for identified support staff to complete data collection and reporting activities. Intentional and effective processes to train staff on and implement the technology are vital elements to success. Organizations experience greater benefits from the implementation of these technology solutions when staff are confident in their use of it. The application does include a question about the organization's plan to train staff on and implement the technology. So we are looking for that intentional plan both within your application and within your proposed budget. So breaking down specifically what that $2,500 per primary care provider may be used for, it does again include both the technology costs and the non-technology costs that you'll need to commit to this opportunity for success. The technology costs include the upfront purchase of the technology solution to reduce the EMR documentation time and any needed technology accessories. The non-technology costs include the primary care provider time to train on and implement the technology solution, as well as the staff time needed to collect, analyze, and report the EMR event logging data back to IPHI. We'll provide technical assistance through these processes to organizations that are granted funds to reduce any barriers and reduce the burden of the processes of participating in this pilot. We'll pause again here after that eligibility just to see if we have any questions at this point. So I do see a question from Alson Ballard. Would non-technology costs be able to cover costs of lost revenue during provider or training time? For this opportunity, it would not. Those non-technology costs are going to cover that protected training time for the providers, as well as the time needed for the support staff to do the data collection and reporting throughout the full grant period. And we'll give just a second for any additional questions. Thank you for that question. We'll make sure to add that to our FAQ as well, so that others applying know that distinction. Perfect. Well, please continue to put any questions in the chat or raise your hand as we go through, but we'll go ahead and continue now to a discussion of the grant period. So this is a pilot project. Grant funds will be awarded on a rolling basis. So the start date of your award will depend on the date of approval. And we'll talk in more discussion about the timeline that you can expect to receive a decision after the submission of your application. This iteration of the project is currently set to end on September 30th, 2024. The reporting requirements as of now would only be through that period following implementation of the technology. Next, we'll dive into more detail about the application process itself. If you're starting to think that your organization may be eligible to apply, and this is a funding opportunity that interests you, this is the section that you're going to want to pay really close attention to, because this will really let you know everything that you need to prepare for. Applications are being accepted now. We started accepting in April of 2024, just earlier this month, and that application form is available and live on our website. You can access that link not only on our website, but via social media channels of IPHI, DC Health, and DCPCA as we continue to promote this opportunity, as well as through the RFA document and other supporting materials. We will continue to make awards until all of the grant funds have been exhausted. A minimum of 8 organizations will receive funding, but we do anticipate more. Based on the size of the requested budgets from applicant organizations, we may be able to fund up to about 20 organizations beyond that minimum of 8. Reach out to IPHI if you need a copy of the link sent to you directly via email, or if you have any questions at all or issues accessing that form. If you registered for this webinar, you will receive a copy of this presentation. And as you can see on this slide, it does include a link to that webpage. In addition to the live application link, there is also a sample copy of the application available on IPHI's website. We do recommend using the sample application form to prepare your application outside of the live application link. And then once you have all of your responses and materials ready, then you can just simply transfer that information to the online submission portal. Depending on who is completing the application and the type of access that they have to particular documents required, which we'll go over shortly, I do estimate that preparing everything for this opportunity, including the responses to the application as well as the budget, may take up to 2 hours. But then once you have all of those materials, transferring it over into the portal, uploading your documents and hitting submit shouldn't take too long. I would say probably about 10 to 15 minutes maximum if you have everything prepared. So as we go through the details of the application form, we'll cover the organizational information requested, the primary care provider details, the EMR system you're using currently, the proposed technology solution to reduce that EMR burden, your budget, the affirmation requirements, and the document upload. So I'm just gonna change my screen over briefly to go to that sample application form so we can go through those required information together. So here, it will give a brief overview of the project, just so you can make sure that you're in the right spot. This is only a copy of the application for reference and planning. All applications must be submitted using that application link on our website. So again, please reach out if you have any issues accessing that. As I mentioned, it will require organizational information to be provided. This includes the name of the organization, A drop-down menu will allow you to select your organization type. You will be asked to confirm the organization address, which again must be located within the District of Columbia. A point of contact for the application will be your first and last name, title, and contact details. If a financial point of contact is different from the applicant point of contact, you're asked to provide their information as well. This will make the process of setting up payment accounts for organizations that are awarded funding much easier and streamlined down the line. So if you are able to provide that information up front, it just helps with the streamlining of the award process. You will also be asked to confirm that % of primary care encounter volume. Again, this is part of the eligibility requirement, so we will be reviewing this to determine eligibility once the application is received. Next, you'll be asked to provide the primary care provider details. You can repeat this up to 10 instances for a maximum of 10 primary care providers included in the pilot opportunity. Here, you'll be asked to provide the name of the primary care provider, first and last name, as well as their NPI number. For the EMR system information, you'll be asked to indicate the current electronic medical record system that your organization is currently using. And then you'll have a 1,000-character limit to briefly describe the primary challenges cited by providers at your organization when utilizing this EMR system. For the proposed technology solution, you can indicate the anticipated technology solution that you will be purchasing. Briefly describe the expected impact of implementation of that proposed technology solution. How do you think this will help your organization, or how do you think this will help your providers? And then really importantly, here's that question about the plan to implement the proposed technology solution and provide that opportunity for them to train on and implement. So make sure that you include that response here and have a plan on how to do that. The budget on the application form here, it will actually only ask you for the total budget, and we'll go through the specific budget template that you'll be asked to upload along with this. So you won't be asked to provide the breakdown, only the total budget in the application form. A quick affirmation, a yes, no, just indicating that, again, you do have the authority within your organization to submit an application on their behalf, and that all of the statements within the application are true to the best of your knowledge. A signature box. And then on the last page of the application is where you will be able to upload your required attachments. The required attachments are also part of the eligibility review, so make sure that you have all of these when you go to submit your application form. This section here on the application form sample is a great checklist to make sure that you have everything prepared as you go into that online submission. The budget. Again, we'll go over this budget template together shortly, so I'll show you that, which is available on IPHI's website. A certificate of clean hands dated within 60 days of application submission. A current business license. This is a certificate of licensure or proof to transact business in local jurisdiction of DC. A current certificate of insurance. A copy of the organization's cyber liability policy. For nonprofits only applying for this funding opportunity, a copy of the IRS tax exempt determination letter. Again, for nonprofits only, a copy of the IRS 990 form. For all applicants, a current list of the board of directors. This must be on letterhead, signed and dated by a certified official from the board who cannot be the executive director, and assurances and certifications. These required attachments are asked for because all sub-grantees to this opportunity must meet the guidelines for a DC Health grantee. So a copy of this information, as well as samples of this, are all available on DC Health's website, and we'll provide that as well in case anyone would like to review further the context or background to the requirement for these particular attachments. So moving on to that budget. The budget template includes detailed instructions to help you fill out the budget form. Instructions are on tab 1 of the document, and then the budget form itself is on tab 2, and I'll show you that in just a moment. You'll be asked to upload a copy of that budget and then again just provide within the application itself the total budget amount requested. So here is a copy of the budget template. This is tab 1 down below. You can see instructions and then DC DOH project expenses. So tab 1 instructions, it gives row by row instructions to fill out this budget, and helps you to understand any of those limitations that you need to remain within for those certain allowable expenses, the non-technology costs, the technology costs, and then the overall limit of the $2,500 per provider. So this will take you through that. It does also include our contact information here for IPHI, which you'll receive at the end of this presentation as well. Please feel free to reach out with any questions. Sam and myself are available to answer any questions about the application, the budget, or the required attachments, and we'll be available throughout the application process for that assistance. On the second tab is where you can input your expenses. You can add rows as needed, and it will total up your subtotals and your overall budget requests there. So again, you can download this from our website, and please reach out if you have any questions or issues filling out or accessing this budget template. So in this section, we'll discuss what to expect after you submit an application. We've gone through all of the required questions. I know you guys have all of that information, understand your systems, and understand how this type of technology might impact your providers. So it'll take a little bit of work to gather everything up and put it together, but I don't think that it will be a hard application for any of you to successfully complete. Along with the budget as well. Please reach out if there are any questions, but it is pretty straightforward based on those requirements that we reviewed together. So assuming that you are eligible and you do get that application in successfully, what can you expect next? The first thing that we'll do is an eligibility review. This will happen immediately after receipt of the submitted application. So for that eligibility review, we are going to be looking at those key factors, including location of the organization applying. This must be located within the District of Columbia. We'll also verify that the organization applying is a primary medical care setting. That organization must provide primary medical care in the following settings: outpatient ambulatory health site or outpatient clinical site located in a primary care health professional shortage area. As we discussed, the organization must deliver 45% or more of the site's primary care encounter volume to beneficiaries of the Department of Health Care Finance, including Medicare, Alliance, sliding fee, or uncompensated care. If the organization meets all of those base eligibility requirements, then we'll move on to verifying receipt of all of the required documents. Required documents include the complete application form, the complete budget form, as well as all of the additional eligibility documents. This list here. So again, you'll have a nice checklist both in the presentation as well as in your RFA and your sample application copy to make sure that you have everything you need to apply here. So use those checklists and please reach out if you have any questions about those documents. So once we review the required eligibility and the documents, if there are any questions or concerns about the application at this point in our review, Sam or I will reach out to address that question or concern with you. So we will give folks an opportunity to address potential eligibility issues or to provide missing information at the time of submission. We are accepting applications on a rolling basis, however, and when we outreach to correct information in an application, it will not hold your line or hold your place in line. You will be asked to resubmit the information, and that is when we will accept your application, is when you resubmit it with the updated information or the full required materials. But again, we will reach out at this point in the review process if we have a question, think that the organization isn't meeting eligibility, or if there is any missing documents. And then the very last thing that we'll consider during the review process is the availability of funds. So basically, if you are eligible, you've provided all of your required documents, and there are sufficient funds available to meet your budget request, then you will be approved for funding within this opportunity. This is not a competitive grants process. It is a first come, first serve based on eligibility of the applicant. So we will be looking at eligibility, confirming receipt of required documentation, and then confirming availability of funds. The eligibility documents are important. As I stated, all sub-awardees must meet the standards of a DC Health Grant recipient, and this will require verification of these documents. So we will include that link to the DC Health site so you can see their requirements, but that's what this is based on. And again, just reach out if you have any questions about this. So for the timeline of these activities, once you submit your application, you will receive a series of communications from us as you move through this review process. First, you will receive a confirmation that your application has been received into our system. This will happen at the time of application. So if you hit submit on that application form and it is successfully transferred to us, you will receive a message on your screen that says, "Thank you for submitting your application to IPHI." Make sure that you receive that message after you hit submit. If you do not receive that message after you hit submit, please reach out to us to confirm that we have received your application. I would hate for someone to think that they have submitted an application and to not be in line for that funding opportunity. So you will receive that notification at the time of application once you hit submit. Then, once we have received your application, we will begin the eligibility review process. This will take us up to 3 business days. At that time, the point of contact that you have identified on the application will receive a notice. That notice will either let them know that we believe the organization does not meet the eligibility criteria, that the application was incomplete and additional information is being requested, or that the organization meets the eligibility criteria and the request is under further review. So after your submission, at the 3-day mark, business day mark, you will receive some type of notification, either letting you know that you're moving on to the next stage of review, or giving you an opportunity to address a concern with your application. And that concern may be eligibility or missing information. So we will give that opportunity for folks to address those concerns at that time. Then, once we have confirmed eligibility, within 7 business days, we will send a final decision, letting you know if your request has been approved or not. This decision will include the awarded amount, if applicable. If you are asked to resubmit information, this 7-day countdown starts at the time that you resubmit the information, not from the time of your original submission. All approved applicants will be required to execute a subgrantee contract with IPHI. So we will provide that contract following the notice of award, if the organization is awarded, and then the grant period will start upon execution of that contract. For technology solution support, DC Health is pleased to offer technical assistance to grantees. As Sam said, the DC Primary Care Association, or DCPCA, will be available throughout the life of the project period to provide training and implementation support. Working with DCPCA is at no additional cost to grantees. This is included with the costs being covered by DC Health. This technical assistance is available to grantees utilizing the eClinicalWorks EMR system. IPHI is actively working to identify relevant resources for grantees that may be utilizing alternative EMR systems, and that information will be available on our website. But we do understand that eClinicalWorks is highly utilized in the DC area, and so grantees using that eClinicalWorks system will be referred to DCPCA, and together you'll be able to assess your training and technical assistance needs. So to reiterate, organizations not using the eClinicalWorks EMR are still eligible to apply. Please do not think that because DCPCA is providing technical assistance for eClinicalWorks, that you are not eligible to apply if you are using an alternative system. You simply will not have the added benefit of having the technical assistance from DCPCA, but we will do our best to fill in some of that assistance through alternative resources. And finally, in the home stretch of our presentation, before we turn it back over to the crowd for any questions, we will briefly review the reporting requirements affiliated with this grant opportunity. I say briefly because if you are awarded funding, we will work directly with you to make sure that we are accommodating the needs of your organization in participating in this pilot. It is a pilot project, and we do not want to add additional burden on the organization while we're trying to reduce it through EMR technology solutions by overburdening you through reporting and data collection requirements. So we will go through these, but please understand that we will have the opportunity for conversation following award to work with each grantee to ensure that you're able to meet these requirements. So grant recipients will be required to report monthly to IPHI. Those reports will be submitted through a simple online survey, and for invoicing processes through a very simple pre-populated invoicing form as well. IPHI will offer technical assistance to all grantees throughout the grant period to provide assistance in doing the expense reporting and invoicing and the data collection and reporting as well. So no grantee will be left on their own to work through challenges in these areas. Again, we'll make sure that we're working with each grantee to accommodate their needs to meet these requirements. As a quick overview of what to expect, however, reports will include expenses and data. For the data, the project will require a before and after. So we'll do one piece of data collection before the organization has implemented the technology solution, and then we'll collect information after the implementation of the technology solution. So you can see here some of the data that is requested in each report. For expenses, if you are purchasing that assistive technology solution, we can provide the cost and the funds up front for the organization to purchase that. And then as providers and staff utilize that time to train on, implement, or collect data, you can submit their hours and we will reimburse for the hours for the staff time. And then for the data collection and reporting, we will collect information on provider burnout and documentation time. This includes the Mini-Z 2.0 wellness scale. So some of the information will be provider directed or self identified information from the provider's perspective, and then other data will come from the actual documentation time in the record. I think that's everything for reporting details that we want to go over now. The primary care encounters, as I said, will continue to confirm eligibility about the 45% primary care encounter volume throughout the grant period. So any grantees will be asked to continue to report on that information as well. So that is everything for the application and the submission and what you can expect afterward. We do still have about 15 minutes left in our time, though we hope to get everyone out a little bit early. So we will dedicate the remainder of the time to any questions that you all have, but also understand that you can reach out by email or phone if you have questions or need assistance through the application process as well.
Lauren, we have a question in the Q&A box. Ricardo Fernandez asked, our organization is headquartered in DC, but has 2 clinical sites, one in DC and one in Maryland. Would we be restricted from involving the Maryland providers in this grant?
Yes, yes, Ricardo, you would. The eligible sites must be located within the District of Columbia, and that is true for all applicants that will be awarded under this grant. So the organization or the funding opportunity is being offered by DC Health, and they have a direct interest in serving primary care providers living within and serving residents of the District of Columbia. So you are correct. The clinical site in DC would be eligible, but the clinical site in Maryland outside of Washington, DC would not be eligible. Thank you for that question. We will make sure again that we include that in our FAQ so that any others with a similar question have the same access to that information.
Question we have in the chat, Lauren. Can you talk more about the reporting requirements regarding documentation time?
Sure, Alsan. The reporting requirements for documentation time. This is definitely something that we will need to work with individual grantees for, because we understand that the features and capacity of each EMR documentation or each EMR system may be different as far as what it is recording. The reporting requirements for documentation time will be collected in several ways to help with the needed flexibility in this area. So there is one part of the questionnaire which asks for the primary care provider to estimate the perceived documentation time in weekly periods based on their work. And then if the data is available in the EMR system, it asks for that event logging data. Some systems may provide information tracking when a particular user has entered the system to document a patient's record. Other systems don't track that. So again, we'll work with each grantee to determine their organization's capacity for that. And then we also recommend that the organizations build in a few random observation period data collection points. So this would be where the staff time is actually shadowing the primary care provider for a random sample of their documentation time, and actually timing and recording that so that they can get more accurate instances of that. And we can use that to kind of triangulate and reduce or increase our confidence from the data being collected from the primary care provider, as well as from the EMR event logging system, which, as I said, may be inconsistent across grantees. And as we all know, the recall of a busy primary care provider of how much time specifically they've spent on documentation may not be accurate down to the minute. So we do recommend if your budget has the capacity to include some time for the support staff to do those observation data collection periods just a few times per month, maybe 3 times per month to get that more accurate capture. And that can help to supplement and complement the other information that we're collecting. So hopefully that answers that question. There is a detailed description of all of those reporting requirements and what we're asking for in the RFA document. So please feel free to review those. And if you do have any particular concerns or challenges within your organization, feel free to reach out to us about that, even as you go through the application. Again, it's not a competitive grant process. So as long as we feel like it's something that we can work through with you and, be able to still meet the requirements and intent of the grant, then we will be flexible with the grantees in this pilot. So yes, please reach out if you think that you might have a challenge and you're not quite sure how that will proceed with reporting. We're happy to talk with you, happy to work with you to make sure that we are able to accommodate what your organization can do as far as capacity for reporting. Any other questions? Great questions so far. Awesome. Well, I won't keep everyone unnecessarily. So thank you all so much for your interest in the Improving Healthcare Workforce Wellness Funding Opportunity. IPHI certainly recognizes the value of primary care providers, and we are very grateful to be able to offer this innovative and promising solution to maintain the strength of this workforce. We do hope that we've answered all of your questions today, but it was a lot of information thrown at you in a short amount of time. So please reach out to us at the email that you see on the screen if we can be of any further help. As a reminder, All registrants for this webinar will receive a copy of the recording and the presentation slides via email. The same materials will also be posted to our website. Thank you again, and we look forward to receiving your application. Have a great day, everyone.